Well, thank you very much. We're going to talk about something very important. We're going to talk about your health here. We have a dermatologist, Dr. Renata Prado, with us with Vanguard Skin Specialist. Welcome to KRDO.
Pleasure to be here. Thank you.
Well, you've been here before, but this is really an important topic. Skin cancer is very prevalent in our society, isn't it?
That's right. It's very prevalent. It's actually the most common cancer we have. It's skin cancer is more common than any other cancers, all the other cancers combined. So very prevalent. We estimate that about 1 in every 5 Americans will have skin cancer.
And why is that?
So the incidence of skin cancer has actually been, we see this an increase. And the reason is we see a lot of earlier diagnosis. We also see an aging of the population. But we also have this culture of tanning. And we have a whole generation that grew up with this culture of tanning being beautiful and healthy. And they spend their whole lives tanning. And now we also have, in the past several years, decades, we have the tanning beds that also add a significant risk, especially to young females and the young population.
And because we're in Colorado, we're in Colorado Springs, we're over 6,000 feet, that also increases folks who live at this altitude, their risk too, doesn't it?
It does, it does. So Colorado actually has, being at this altitude, it has an increase in the intensity of the UV radiation. And that definitely is a significant risk in developing skin cancer.
Doctor, how do people protect themselves?
So the American Academy of Dermatology recommends people seeking shades between 10 a.m. to 2 p.m., 2 to 3 p.m. We also should be wearing some protective clothing, wide brim hats, our sunglasses, and also wearing our sunscreen. It's just important to remember that it's not just the sunscreen, which most people tend to not do anything else but wear sunscreen, and they're not necessarily wearing it correctly. So it's important to do all the measures and also wear your sunscreen correctly. That means reapply it every 2 hours, apply enough of it, and use a sunscreen that has an SPF or the sun protection factor greater than 30, and that's also UV and UVA protect you against both UVA and UVB, so it's a broad spectrum sunscreen. Okay,
doctor, if folks would like to reach out to you at Vanguard Skin Specialist, maybe get an exam, how do they do that?
So they can schedule an appointment. They can call our office at 719-355-1585, or the website's vanguardskin.com.
All right, good to talk to you, and some very important information.
Thank you, it's a pleasure.
Thank you. Back to you.